We have focused a lot on the story on one of the most important and largest parts of the tragic coronavirus deaths that have happened in America. Yes, we know that the virus attacks the old primarily, but the level of acceptance and in some rare cases what appears to have been outright negligence that led to some of these deaths certainly cries out for some inquiry and some investigation. So it's easy to see that something is just not right in some of these situations, and we owe these people, the veterans among them and their families, some answers that are better perhaps than this one that we heard today from the governor of New York. He was asked about the 139 New Yorkers in long-term care who died, and that was just on Saturday. Here's what he said.
Say to families who've suffered losses inside nursing homes and they're looking for accountability and they'd like to see justice.
How do we get justice for those families who had 139 deaths? What is justice? Who can we prosecute for those deaths? Nobody. Older people, vulnerable people are going to die from this virus. And that is a fact. And that is not going to change.
About 5,600 New Yorkers died in nursing homes of COVID-19, and new nationwide data says that 41% of all the deaths in America from this virus are traced to nursing homes or assisted living facilities. 41%. So joining me now is the person in charge of overseeing these facilities at the federal level, administrator for the Centers for Medicare and Medicaid Services, Seema Verma, also a member, of course, of the White House task force on the virus. Thank you so much for being here tonight, Seema. Good to have you with us.
Yeah, thanks for having me. Good to see you, Martha.
So good to see you. So what's your reaction, when you hear that from Governor Cuomo? And I've spoken to families who have lost loved ones in this situation. That is not a statement from him that is going to give many of them a whole lot of comfort.
Well, Martha, every life is precious, and that's why this administration started very early in making sure that we were doing everything we can to keep nursing home residents safe. They deserve that. Older individuals have taken care of us their whole lives, and they deserve to be respected and to be protected.
So I guess when you say you've been doing everything that you can, I'm curious what that exactly means. What have you, from the federal perspective, mandated? Did you mandate testing right away? Did you surge tests to all of these facilities around the country right away? That's one question that I have. What did you mandate in terms of testing? And when?
Starting from a broad oversight, from the very beginning, we recognized that nursing homes were going to be vulnerable, and we put out a series of guidance and recommendations to our nursing homes. We also have been working with state and local officials. Just as level set, the responsibility and oversight of nursing homes is both the federal and state government. On the federal level, we set the guidelines, and the states are actually boots on the ground. They do the inspections, and they're responsible for licensing. And one of the things that we did very early on... So you only
do, let me just clarify that. So you would say that you do not have any ability to mandate anything that happens at these facilities? Is that what you're saying? You cannot mandate anything at them?
The federal government sets requirements, and so if a nursing home is in violation of any of those requirements, there's obviously sanctions or civil monetary penalties, and we also had the ability to revoke our Medicare and Medicaid payment. But the licensing of these facilities and their ability to operate rests with the state. So it's a joint federal-state partnership.
All right. So one of the things that I've heard from people that I've spoken to at nursing homes is that in the beginning they couldn't get the tests that they wanted. Then when they got the tests that they wanted, it would take at least a week to turn them around. So they would have patients together in these sometimes close quarters where, they're waiting a week, and by that point it's too late. And the virus has begun to spread, throughout that entire hallway. So why is it, having seen what we saw in Italy, we knew that the first hotspot was Washington State in the home there. Why wasn't it that the best tests that we had were not surged to these facilities, which we knew housed the most vulnerable population in the whole country, right away?
Well, one of the things that we called on, weeks ago is a call to action for state and local leaders to emphasize and to work with nursing facilities to make sure that they had access to testing. One of the things that we did on the federal level was to increase reimbursement for testing and actually for the first time pay for labs to go out to nursing homes to collect samples. So on the federal level, we've made that recommendation, we've called to action, and you've seen a response to that. We've seen governors across the country testing their nursing homes. You've seen that increase in reimbursement, and because of that, we're seeing more and more nursing homes being tested. But today, we issued guidelines for state and local officials and nursing homes about reopening. And as part of that reopening...
But it sounds like you've decided to stop short of mandating any of it. I'm looking at a quote from the president. He was asked if he wanted to consider a nationwide mandate for testing at nursing homes last week. And he said, I would mandate it if you'd like. I think it's an important thing to do. And we know that Vice President Pence has talked about it, too. But up to this point, can you just clarify for me that the federal government has not mandated that these facilities test and provided them with the ability to do so? Is that a correct statement?
We've put these recommendations and guidelines for states and for the nursing homes. We've talked to the nursing home associations. They're supportive of these efforts. Governors are supportive of these efforts. But if we felt like there wasn't compliance, then we could move towards a requirement. But at this time, we feel like the recommendation around testing as a baseline. So we not only want to test the residents, but we also want to make sure that all of the healthcare staff in that nursing facility is also tested as well. And that's going to create a baseline.
Everybody wants to make sure that that's what's happening. But from what I'm learning, looking into this, it's spotty. Some places don't have the test they need. Some places did have the test that they need. With regard to the other question that I have, that in the initial surge of this, when we knew these were the most vulnerable places in the whole country, and then we built these FEMA facilities with a lot of extra beds, and then it was, sort of good news that all the beds weren't needed. And in some cases, we have pictures of all of these going up, these incredible facilities that we heard about. And then, April 30th, you have the Comfort in New York City, which was converted to be a COVID facility, sailing away from New York at that point. Why was, and if the answer is that this is not a federal question, it really falls to the governor, and I've asked, New York officials this as well, but what do you say to why those individuals weren't taken out of the nursing homes where they were infecting people all up and down their corridor and put in these places that were such a wonderful facility that was built by the Army Corps of Engineers?
That's right. And Martha, it's very clear, federal guidelines make it very clear that when you are discharging a patient from the hospital, there's the obligation to make sure that that patient is being discharged, whether it's going home or going back to the nursing home, that the nursing home has the capacity to deal with those patients. And so if a nursing home is saying we're not able to accept that patient, then that's something that has to be taken into consideration. When doctors and hospitals are discharging patients from hospitals, they have to make sure that we are discharging the patient to a place that can accommodate their needs. And if that person is still unfortunately testing positive, then they need to be isolated, and we need to make sure that that isolation and care can continue in the most appropriate setting.
Well, we know that in New York and New Jersey, the epicenter of the virus, both of those governors insisted that those patients, when they were released from hospitals, went back into the nursing homes. And I haven't been able to get an answer to why they weren't sent to these other facilities, because we know that once they went back to these places, they infected other people who, some of whom ended up dying as a result of that. So it's tragic. And it is, in my mind, one of the most important questions to be answered in this whole thing. 40% of the people we've lost have been in these nursing homes. Seema Verma, thank you very much. Good to speak with you tonight.
Thank you, Martha. Thanks for having me tonight.